And we are live. Hello, tribers. Can you see me? Can you hear me? Please join us. Yes, I can see that we are live. If you're able to hear us, please let me know in the comments if you can see me. In the meanwhile, please let me know which city you are joining us from. I always love to hear from you where you're joining the live session from. So today's topic is very interesting, and as per the changing weathers is also very important for us to know all the information that we will be sharing in today's session. Today's session is going to be about importance of advanced and newer vaccinations. And to discuss this topic, we have with us Dr. Ashish Jaiswal. Dr. Ashish is a very experienced neonatologist and neonatal intensivist who received his training in premier national and international institutes with more than 10 plus years of experience. He was awarded gold medal for first rank in national level exit exam of fellowship in neonatology. He is very experienced in managing complex medical and surgical conditions in neonatal intensive care unit. He resuscitates and provides aggressive care to extreme preterm as low as 25 weeks of gestation with good long term growth and developmental outcome. He is specialized in advanced ventilation, central lines, peritoneal dialysis, chest tube drain, and point of care ultrasonography in neonates. He aims in practice evidence based cost effective medicine in NICU to increase intact survival of babies. Welcome to the session, doctor. It's a pleasure to have you with us today.
Thank you, Shweta.
Doctor, any opening thoughts for this session today?
Yeah. So, as today's talk is on the vaccine and vaccination, we all aware about the years back when there was COVID era. We are now calling it as era because it was so impact on our lives that there was, and how we have been overcome of that era. One of the cornerstone of that getting overcome from the COVID pandemic is of the vaccination. It has been already established. So the COVID has told us about how important is the vaccine in preventing the diseases which are the infectious disease, which are the vaccine preventable disease we call, because we have the vaccine for those disease. So this is something which is very important. We should aware about the how the vaccine works, what diseases the vaccines are available for kids, and how can be helpful for us from preventing and either diseases or reducing the impact of the effect of the disease on us.
Right, right. Okay. Doctor, why is it important to stay up to date with the advanced and newer vaccinations? And why is it important for parents to understand the importance of these vaccines?
Yes, as I told in my opening remark only, that why it is important for the vaccine, because see, suppose what we say to stay healthy. Like, if suppose if I will ask you what do you want to be to stay healthy, so you will say that what are the diseases which help comes to us to adult. There are like obesity, cardiac disease, all those. You said it, eat healthy, don't eat the unhealthy things, do the exercise regularly so that we can fit. So this is the one of the way to keep ourselves fit and free from the diseases. But what kind of diseases? These are the diseases which are the disease because of the lifestyle. Similarly, there are set of diseases and called we call them infectious disease. They occurs because of the some microorganism, whether it is bacteria, whether it is virus, or if it is fungus. And these diseases are known since ancient times, right? There are harmful microorganisms which can cause disease. So with the time we get to know the new threats coming, new diseases are getting discovered because of different new bugs, and then there are vaccines research has been done for them, and we come to know. So it is very important for us to know that for the like lifestyle disease, we want to get the fit healthy lifestyle. Similarly, for the infectious disease, we need to either keep ourselves immune from those disease, or to keep ourselves refrain from that bacteria or microorganism. So like in COVID era, it was not possible for anybody to avoid contacting to the COVID. So
Yes.
if I will, even if when people are staying inside their houses, there are risk and threat for the getting the contacting with the virus. So it is not possible that you can avoid virus completely. So what else you can do? Second thing is to get yourself immune for that virus. How you can immune? By getting the vaccine. So what the vaccine will do? Vaccine will help you getting either preventing at all a disease, or if the disease comes, the severity and effect of the disease will be less. So it is very important for parents to know that it is that whatever the new vaccines are available, and if you have those vaccines, you can get prevented from getting the disease.
Okay. And how do these vaccines contribute in prevention of emerging diseases and health threats?
Yeah. What vaccine does? Vaccine is basically, we say the prevention is better than cure. So vaccine induce the immunity in our body, and whenever the new whatever the new disease, not only for the establish the diseases, whenever the new emergence disease came, like COVID came, the vaccine research starts for that one. And if they will develop the vaccine, and if you inject with those vaccines in your body, the body's immunity response for that disease improves. And whenever the natural disease comes, probably that will help in the body to fight against that disease.
Right. Okay. And when we're talking about vaccination, we often refer to the term immunity a lot, right? Especially as you referred to the COVID era, immunity has become a hype word ever since the COVID era. So could you please explain to us in brief what exactly is immunity and how is it related to vaccinations as well?
Yes. So, what exactly immunity you said, Seta? It was very important. So, vaccine basically immunity is the ability of body to fight against any disease. In terms of when you called about the infectious disease, it is the ability of body to fight against that infection. How the body fights for a disease also is immunity is in different way. There are the cellular immunity versus there is a humoral immunity, which is because of the antibodies. What the cellular immunity is because of T cells and K cells which are there. Even our body's skin and all our body system help in getting the preventing immunity from the diseases. Even what we eat, when it goes to the stomach, there is a acid which helps in the getting neutralizing the bacteria and virus which can go through the ingestion and help in the getting immunity. In terms of the vaccination, what we basically tells refers more is to the humoral immunity which helps because of getting the generation of antibody in our body. So basically, there are two ways to get the immunity to a disease, either by the natural infection or through the vaccination. How the natural infection, if suppose I get contracted a disease, then my body will definitely try to fight against that. During that process of fighting, my body will develop the immunity and antibodies, and through antibodies that disease will go off, and I will recover from that disease. Now my body will have some memory from last previous infection. So suppose if the same bacteria or virus again comes to in my body, it will start there are the memory that there is a this kind of immunity has to be to back. So immediately that as it get started, and I will my body will again start forming those antibodies, and I will prevent either contracting that disease, or I will recover much sooner. But this facts doesn't prove makes in the most many of diseases. And in this case, the natural immunity comes after getting one episode of disease. And what we want, sometimes suppose if it is a very killer disease, you can't try to get a natural immunity that I will get immunity and then next time I will have a protection. So what the vaccine are basically some type of, in some way, that microorganism, whether it is virus or bacteria, either it is killed or it is attenuated in a way that it can only produce the immunity, but it won't produce the severe disease. So in the way in vaccine, the virus or bacteria is introduced in our body in some way, either in their killed, attenuated, and sometimes even it is a subunit also, though it is not complete bacteria or virus, but it is a part of cell of that virus that is introduced in our body, and then it will initiate an immune response, and that immune response help us to getting disease when the second time the same virus or bacteria get naturally we are exposed to that one. So it is
Right.
a process of inducing the immunity through the vaccines by sensitizing our body's immune system.
Okay. And Doctor, could you please shed some light on what role does research and innovation play in development of newer vaccines? Are the newer vaccines different from older vaccines? Is there a change in generation of vaccines here?
Yes, the two kind of vaccines research which we say that one is the research going on for the vaccines and diseases for which the vaccine is already available. So suppose you take an example of the polio, which everybody knows. So there are three kind of polio virus type 1, type 2, and type 3. So initially the when the vaccine was started, it started for the only one virus, because that was the only virus which was prevalent, and they thought it is the only vaccine which so vaccine research not only help more and more development of newer vaccine, but the same vaccine it will improve the vaccine's efficacy and number of strains coverage. So the newer vaccines which are different in the same vaccine is that either it will be more efficacious, it will have more number of strains of virus. Like there is not only one strain of virus which cause him, like ours is, you say the human beings are, we are the having ethnicity in strains. There is something American, Caucasian, Asian. Similarly, in the viruses, there are various strains of the virus which is there, various strains of the bacteria which are there. So newer vaccines are the more efficacious in the way that they have more number of strains incorporated in the vaccine, and the not and there would be more efficacious. How efficacy you say, the suppose if I will get the vaccine, how whether there will be the development of immunity or not there. So when the research is done, they will see that if suppose today I am not, if they checked my blood sample and I don't have the antibody for certain, like say for COVID virus, and when they will inject me the vaccine, and then after certain period of time they will again take the blood sample and see whether the antibody is there or not. This process is called seroconversion. So if it is a you are seronegative, means you are negative for that antibody and you are positive for that virus antibody. So this efficacy, how number of patients got injected vaccine and how many of that get got converted to a positive antibody. So this efficacy with the new vaccines, the efficacy is much higher compared to older one. And sometimes if some vaccines has been introduced and have some adverse effects, so more and more newer vaccines are more safer compared to the previous generation of vaccines. And in pediatric population now, the more research is also on the combination of different vaccines. Suppose if you say that there are 10 vaccines you need to get for your kid, and it will be pricked for 10 times, probably you won't say, oh, I don't want, anybody don't want, not only for kids. So the combination of vaccine is also an area of research which is going on, and there are vaccines in which one single syringe will have the vaccine for almost 6 to 7 diseases in the single injection. Similarly, as you said about getting the new diseases like COVID came, we know that it was a completely new virus for the our human population, and then the vaccine has been research and trial. In fact, COVID is one of the disease where the vaccine was made so fast and the trials has been completed so fast. There was those some lacunas, but it has been proved. So the vaccine research is also for the newer diseases as well as for the established vaccines, which can be make more effective and more easier to administer.
Right. Okay. What are the different or new vaccines that parents should be aware of?
Yeah. So now more and more number of diseases are vaccines are getting developed. Right now, the vaccines there is two types. One which is in the research and one which is in the practice. So I think parents should be more aware about what the vaccines which are available in the practice. Practice means they have been already licensed to be used for a population specified like kids, in the thing, and they should be like the new year vaccines is available for meningococcal meningitis, for pneumococcal vaccine. Similarly, vaccine is available, if good effective vaccine available for typhoid, which is a very routine disease. The right now there are many, we see in the rainy season, the in diseases which are because of waterborne, because of the contamination of water in this rainy season. The hepatitis A virus, which is very common, causing the jaundice in the kids and adolescents, including even in adults. Similarly, there are typhoid, which is happening because there are the effective vaccines available for both of them. Similarly, there is called something called cervical cancer in the females, which is happens in the later on in the age, but it has been postulated that one of the virus, which is called human papilloma virus, if you get recurrent infection of that virus, then in the long run there is more chances of getting the your body to be developing the cancer for that cervical cancer. So nowadays, if you that human papilloma virus, if you get vaccine in early childhood and your body is immune to that, probably you won't get that infections later on in your life, and ultimately you will be saved from getting the cervical cancer. So these are the new vaccines which are available, which are practiced. And similarly, you need to know about the emergency use vaccines like COVID. It is still not many in kids is for emergency use, and then research is going on for other vaccines like dengue and other also.
Right. Okay. How can misinformation and vaccine hesitancy be addressed to promote the acceptance of vaccines in parents?
Yeah. So vaccine hesitancy is one of the important, and being that misinformation could be a reason for that one. But there has been surveys and studies has been done for the vaccine which are available free from the government, and why still the coverage is not adequate. So in that, there's a few points came up with that the few hesitancy is like first, for most 45% cases is the awareness. It is not that the parents doesn't want or individual doesn't want to get vaccinated. It is they are unaware that there is something called vaccine is available, which is free from the government or which is available in the market, and they can save that. So awareness is still a fact. Then apart from awareness, hesitancy is because of the pre-mindset that a natural thing is better. They don't believe in the vaccine, they believe in the natural immunity. There are in India, even including for polio vaccines, it has been thing in certain religious and custom that it can make the you impotent, or it will decrease your. There are a lot of myths are there with the individual vaccine in different ways. And not only about vaccines, there are a population in the world which doesn't believe in the modernity. They believe that this modern, there are people who are living in the whole forest. They doesn't they take the electricity, uses electricity, and also these are definitely there. But what particularly to vaccine is that if you give the good corrective information, awareness about the availability of vaccines and disease prevalence, probably that can be overcome. In our
Okay.
practice, we usually have the one-to-one discussion with the parents on the vaccine visit about the new year vaccine and their schedule. And most of time, when they get information, they opt for it, and we use the vaccine.
Okay. Okay. We have some very interesting viewers' questions. Let's take a few of them. Kausalya is asking, we have given only government allotted vaccines to my daughter till now. She is 3.5 years of age. Should I request my pediatrician for added new vaccines? She is active and a little underweight.
Yeah. So basically, the government immunization program is also now expanding to most of the vaccines available, but still there are few vaccines which are not there in the government program. Those vaccines can be given to a 3.5-year-old kid also. Being active doesn't mean that you are immune to certain disease, and disease can happen to any time. Underweight is a risk for getting disease because underweight kids are usually have low immunity. So I would suggest if to discuss with your pediatrician that what are the new available vaccines which are not there in your chart, because in some government programs in some state. Few vaccines, added vaccines are like pneumococcal. It is there in many states, but it may not be there in some state. So if it is not there, it has to be given. Like Delhi is giving human papilloma cervical cancer vaccine also, but it is not there in other parts. So it will be particularly to what vaccines has been left. According to that, you can opt for those vaccines with discussing with your pediatrician,
Right.
like
And
typhoid, hepatitis A, influenza, all this.
right. So most of these vaccines are covered in government hospitals, or do people have to
No,
access
these
private
vaccines
hospitals?
which I told is not covered. The what covered is also different in different states, but still, though they're like typhoid vaccine, hepatitis A vaccine, influenza vaccine, and very chickenpox vaccine, these are not covered in most of the scheduled states yet.
Right. The next question is, my pediatrician advising me to give immunity booster for my kid 3 years every 6 months as he started school and prone to infection more. Can that be given like that?
See, I didn't got the question what exactly immunity booster the pediatrician is giving, but what we call there is nothing called immunity booster. Most what we think is eating healthy, good amount of micronutrients, vitamins will help in getting us increasing our natural immunity. But vaccination is certainly specific immunity. Like I got the COVID vaccine, I will be going to get immune for COVID virus. It's not general, but what others else are, what we are eating healthy, are getting some chamanfras or whatever, it is just for the overall immune system. But it be fight to the particular virus? It won't be there. So vaccines are for the specific microorganism, while other immunity booster are for the general thing.
Right. Will there be any side effects for these new vaccines?
See, it is very good question. Even it has been postulated for lot for COVID also. So what when the vaccine research does, it's not they will see the all the first the safety aspect as well as the efficacy aspect. And any vaccine which comes in the market or which is licensed to be for practically use, first it has been safety is always established. There are always some minor side effects with the each vaccine, like at the some pain or redness at the injection site, sometimes some swelling over their injection site. There might be some fever with some vaccine. There would be some like nausea or some illness like similar to that virus. But it will be definitely make sure that there won't be a significant adverse effect to any of the vaccines which has been practically allowed. So adverse effect which is significant won't be there with any vaccine. Even when you ask this question, I will tell you there were a lot been called autism because of the additive which has been used in vaccines, thimerosal and all those. But in long run, that will like vaccine is given to the millions and trillions, and those cases were like in uh, even not less than 0.001. So you can't link to the vaccination alone in those cases, and research has proven that. So but presently I can say the whatever the vaccines are available to use, licensed to be used, are safe, and they don't have the any kind of adverse effect which is to be bring to the of the concern. Second thing comes the reactogenicity. So anybody can be react allergic to any kind of thing. It's not vaccine, any drug. So that is individual's thing that cannot be implicated to general population.
Right. The next question is also interesting. Why is there a difference between government vaccinations and private vaccinations?
See, there is no difference between the government and private vaccination. If the vaccine is similar, the government immunization program still doesn't cover all the vaccines which is available and licensed to be used. Like if you see, even in India, our government schedule doesn't you has all the vaccines. Why it is not so? We are recommending, and if you see, the government is also expanding their immunization program a lot. And since the Modi government is there, almost 14 diseases has been covered now in their immunization program also. And there is some vaccines which are in diseases which are endemic in certain area. They also incorporate, like Japanese encephalitis vaccine has been there in government program in the UP. as well as there are states like Delhi has been also in pilot project to use the cervical cancer HPV vaccine. So government programs, government vaccination are not different. It's only that they have the less number of these vaccines in their basket. Second thing comes about the individual vaccine. So it might be different that the vaccine which is available in the private practitioner may be a different brand compared to that what were available in government, because those are available through the government route, so they don't have choice to use. While in private practice we have the choice of all the available market vaccine, and we can choose whatever best is from that.
Okay. Doctor, could you please explain about HPV vaccine? Is it required for preteens?
It is required for
Preteens, pre-teenagers.
Brilliant. So yeah, right now the HPV cervical cancer vaccine given to the from the 9 years of age, and it is very important to get vaccinated as early as possible, because as I told, the vaccine is for prevention. Cervical cancer is end disease. Suppose if you get a vaccine at 45 years of age and you are already been exposed number of times to HPV virus and you already contracted the disease and your body has been already changed, then probably the vaccine may not be that effective. But if you give the preteens, a age where the sexual activity is not yet started, and suppose you are immune and later on the chances of HPV infection is less, probably the efficacy and end result of cervical cancer also would be less. So 9 years is when you can start giving the HPV vaccine. And right now present vaccine advised to give the two dose of HPV vaccine at 0 and 6 months, means the first dose in 6 months after the first dose, second dose.
Okay. Is there any vaccination for cough and cold?
Good question. So cough and cold happens because of lot many number of viruses and bacteria. There is not vaccine for each and every virus and bacteria which can cause cough and cold, but there are certain common, like if you ask me, influenza is one of the common cause for the vaccine, cough and cold and serious pneumonia, which you have been already like bird flu, swine flu, H3N1 and all those. This has been covered with the influenza vaccine. The quadrivalent influenza vaccine covers to the four types of influenza virus. Similarly, a cough and cold can also happen because of the pneumococcal bacteria and Haemophilus influenzae B. For that also there is vaccine for pneumococcal and Hib.
Right. So, why are some of these vaccines optional and not mandatory?
There is nothing word called option. As you say, whole all the vaccine are option, because right now there is no mandatory act. What is mandatory? Mandatory in our life is, suppose government has made a rule that you need to do the COVID vaccine was even optional in spite of pandemic. So there is nothing called mandatory in India yet. For the though there has been, when the smallpox eradication was happened, there was government has passed a act to that everybody has to take the vaccine. In spite of that, as of now, every vaccine is optional, but the concept of the optional and mandatory came from the government schedule. So if a vaccine is there in the government schedule, we call it as a mandatory vaccine, because the government is giving you free and it has been accepted. Then why you are not taking? So it is a mandatory. And those vaccines which are not there in government immunization program, we call them optional vaccine, because before giving you need to have a discussion with the parents in one to one. If they agree, we need to give those vaccines. So there is, you can say in that way, the vaccines which are available in the government program are called the mandatory vaccines. Which are not available in the government program, we call them the optional vaccines.
Okay. What is the difference between painful vaccine and painless vaccines? Anything major?
Very good question, and very common when you give the vaccines to kids. So there are two kinds of pain. One pain is because of the injecting and injection of the needle. It will be there for each and every vaccine and each and every whether it is painless or what called. This concept of the painless comes with the typical vaccine called the pertussis. So there are two kinds, and it comes in the combination of DPT or the pentavalent vaccines. So there are two kinds of pertussis vaccines. One is the wholesale and one is the acellular. So when the wholesale vaccines used, the chances of getting pain, fever, and redness is more with after injection of getting wholesale, while the pain, fever, and adverse reaction redness is less with the acellular pertussis vaccine. So we call it, people call it as a painless vaccine, and the wholesale is called painful. But apart from this, the pertussis vaccine, most of the other vaccines, there is no concept called painless. Each and every vaccine is same. Only with pertussis, if it is acellular, the chances of pain fever is less. That's why it called as painless vaccine.
Okay. What if we get late for vaccinations by 1 or 2 months? Does that delay cause any harm to children?
Delay doesn't cause any harm until unless your kid is already got exposed to disease, because vaccination is meant for the prevention. So if you get the vaccine early and the day you get exposed to natural disease, you will be saved. So if you delay the vaccine, it just make your child getting immunity later, but otherwise the effect of vaccine will be same. So getting the vaccine on time will make sure that your child will have immunity when there is a natural disease is there. If it is delayed, the and your child is not been exposed, probably the effect of vaccine is same.
Okay. I think we have covered most of the questions. Quite a few of them are repetitive, and doctor has answered them in previous questions. So I request all of you to please go through this video at the end, and you will get all your answers. Doctor, anything according to you that we have missed discussing in this session?
No, I think the viewers' question has included a lot, which has been not that clear in my initial question answer session. But yes, I would ask every parents to know about the vaccines which are available, which are licensed, and ask your pediatrician. And there is new thing is going on, the cost effectiveness of a vaccine also. So 90% of times when somebody doesn't opt for a vaccine, will definitely think of the cost only. So I think that question doesn't comes up, and that was not there in my talk, our question answer session. So how you can relate with the cost is two ways. Suppose cost of vaccine and cost of the after effect that vaccine which has done. So when even government make a policy, the cost of vaccine is just very measurable thing. But if it saves a lot in their impact of the disease, that is called cost effectiveness. When it comes to the individual, suppose you take about the typhoid. Getting a typhoid infection is very easy. Most of time whenever there is a typhoid, child will have a prolonged fever for a week, even beyond the week, and you have to get admitted to child for the antibiotic injection and supportive treatment. Similarly, hepatitis A. So if you get the vaccine and if you save the cost in getting admitted to the hospital, the cost is maybe 3, 4, 5 times. What vaccine costs? 1,000, 2,000. Single admission to a hospital for a day will cost. Right now, the problem is that the our insurance companies is not covering the vaccination because it is a preventive thing. But some companies started coming up with the executive checkup. Similarly, might be the one day they will come up for vaccination also. In few of already there with them some corporate tie-ups. But I would suggest see the cost effectiveness of a vaccine in the terms of the getting prevention from admitting your child, getting yourself healthy, loss of that working days lives also. Suppose a kids get admitted for a 3 days, or even if it is not get admitted, is ill at home for a 3 days, the parents has to take a leave, that would be compensate for your vaccine cost. So ultimately the cost effectiveness of vaccine comes a lot when you get prevented from getting that disease.
Great points, Doctor. Thank you so much for sparing your precious time and sharing all this valuable information with us and all the tribers today. Thank you
Thank
once again, and I hope to have you soon again because this is an expansive topic and we still have questions pouring in. So I'm sure we will have another insightful session very soon with you.
Sure, Dr. Seth. It would be nice to interact with you.
Thank you so much
Thank
to
you
all
very
the
much.
tribers for tuning in today. Stay tuned for more such informative sessions just on Parent Tribe by Super Bottoms. It's a wrap in today's session. Thank you so much once again.
Thank you.